Parents, listen up. What was once almost exclusively a problem for adults is now affecting more and more teenagers. We're talking about kidney stones, and this morning we've got Dr. Shaw with us here with the Austin Urology Institute. Good morning to you.
Good morning, Erin.
So right off the bat, why are we seeing this in kids more right now?
Well, historically we used to see them in adults, 40, 50, 60 and older, and now we're seeing a market increase and a trend in 10-year-old, 15-year-olds, teenagers all having kidney stones nowadays.
What are the factors causing this?
Well, a lot of it, there's a lot of research being done. Some of it's genetic, so it's your parents' genes transferring to you. But on top of that, what we've identified is that it's an increase in all the salty and junk foods that we tend to eat, the fast foods, some of the energy drinks that we were talking about. They can also cause a lot of the increased caffeine. They also cause dehydration because they cause you to urinate more. So it's a combination of a lot of the dietary factors. And on top of it, you turn it, you look at, being a child, say in Central Texas, it's 100 degrees outside every day. You tend to get dehydrated as well.
Got it. Yeah, summer is kind of a key time when you're seeing it pop up in kids more.
And we do.
And does it also have to do with the fact that maybe during the school year they're a little bit more active? Someone might be tracking their eating habits a little bit more at that point.
Right. So yeah. So it's many many factors. So it's the dehydration component, and then when they do hydrate, they're drinking things that are not maybe necessarily good for them, and then you down it with different junk foods and the salt. All of those things kind of create a environment where the urine is a lot more concentrated, and all the particles in there have a much better chance to get together and slowly start forming stones.
And Austin is known for a lot of good things, but Austin is also, Central Texas rather, has a new name, the Stone Belt.
Right, so it's an interesting phenomenon. So it's a stone belt, so it kind of goes over the lower section of the country from the East Coast to the West Coast, all the way to California. As David tells us, it's 100 degrees every single day. You combine that with increased calcium and mineral content in our water, and that's what earns us the name the Stone Belt. So we're in an area of very high risk for kidney stones.
Do you treat kidney stones differently in children than in adults?
Well, the shockwave lithotripsy, where we send energy from the outside, what we do is we use decreased energy and a decreased number of shocks to break up the kidney stones from the outside when that's possible. We also have lasers and different scopes, and they're actually pediatric size, so we can go through the inside, through the urine tube into the kidney to break up the stones. Having said that, children are developing, so the best surgery we kind of say is no surgery at all. So we really try to go into preventative mode. So if your child has had a kidney stone, or mother and father actually have a history of kidney stones, that puts your child at higher risk. So it's very important that you look at hydrating them well. Lemon or lemonade, believe it or not, in the water actually is preventative. It keeps the calcium molecules from sticking together. And then, reducing salt and junk food in the diet.
All right, good advice this morning. Thank you so much, Dr. Shaw, for joining us.
Great, thank you.